Hey everybody, it's Jake Tapper from CNN State of the Union and factcheck.org, and this week we're going to take a look at a claim made by two self-identified Democratic socialists, Vermont Independent Senator Bernie Sanders and New York congressional candidate Alexandria Ocasio-Cortez. They say that a study funded by the billionaire Koch brothers, who are generally, I think it's fair to say, libertarians and conservatives, that the Medicare for All proposal would actually save the government money.
Let me thank the Koch brothers, of all people, for sponsoring a study that shows that Medicare for All would save the American people $2 trillion over a 10-year period.
It shows that Medicare for All is actually much cheaper than the current system that we pay right now.
Is that true? Did a study funded by the Koch brothers indicate that Medicare for All would actually save the U.S. government trillions of dollars? No, it's not true, at least not according to the author of the study. The study in question is a working paper from the Mercatus Center at George Mason University that looked at the 10-year impact of Senator Sanders' proposed Medicare for All plan. Now, while it's true that the Koch brothers have given millions of dollars to the Mercatus Center at George Mason University, and an AP investigation earlier this year suggested that the Koch brothers do have control and influence over the hiring and firing of professors, we should note, for whatever it's worth, the authors of this study said the Koch brothers did not influence them in any way. We asked Senator Sanders' spokesperson. He told us that while the study says Medicare for All would increase the federal budget by roughly $32 trillion, it also says that the projected cost of all healthcare expenditures in the U.S. would drop by $2 trillion. The study's author says that $2 trillion drop is not actually his conclusion. He said that's based on assumptions made by Senator Sanders. In fact, he wrote, quote, "It is likely that the actual cost of Medicare for All would be substantially greater than these estimates, which assume significant administrative and drug cost savings under the plan, and also assume that healthcare providers operating under Medicare for All will be reimbursed at rates more than 40% lower than those currently paid by private health insurance." In fact, he lays out an alternate scenario that does not include savings from provider payment cuts, and in that scenario, the report says that there would be a net increase in healthcare spending. Now, we're not here to make a judgment on the viability of Medicare for All, and we have no idea if the Koch brothers influenced the writing of this Mercatus Center study. But it does seem pretty clear that the presentation being made by Senator Bernie Sanders and Alexandria Ocasio-Cortez about this study lacks a lot of context, and the author of the study says they are not being accurate. A reminder to all you politicians out there, you're perfectly entitled to your own opinions, not to your own facts. I'm Jake Tapper for CNN State of the Union and factcheck.org.